Morning, Ben.
Hey,
Dr.
Dr.
McFresh.
How are you?
Good to see you
nice
again.
To see you
How
again.
are you?
I'm doing fine.
Good.
Doing fine.
So you're here today for your acne?
Yeah, just here for a follow-up.
Benjamin Stoff is in medical residency, training to become a dermatologist.
Mostly it's kind of on the face and a little bit in the chin and can get on the nose and forehead.
He's learned a lot about acne, but still.
It's kind of embarrassing to have as an adult sometimes when it flares. And it's also kind of difficult to remember to do all the elements of the regimen sometimes as well. So it's a challenge.
This challenge affects 25 to 40% of men and at least half of all adult women. Acne is typically thought of as an adolescent condition. In Benjamin's case, his teenage acne followed him into adulthood.
But there are certainly a small percentage of patients that have had clear skin as teenagers that suddenly show up in our office as a 20 or 30-year-old, and it's the first time having acne.
Regardless of when it first appears, acne can have tremendous emotional impact in adults. Severity doesn't seem to matter.
Some people with what we would consider horrible acne go on and are not that bothered. Even when you probe, they seem fine. Others, where the physician would consider them virtually cured, are still very bothered.
Even though Lauren's skin looks clear, for her, acne has been devastating.
If I have an event or an important work engagement, and if I have one of those big, I call them those underground pimples that start under your skin, and then these big, and it's so upsetting. You just don't want to face the world.
In fact, acne's impact on quality of life can be as great as that reported by those suffering from chronic asthma, epilepsy, diabetes, or arthritis.
It would seem surprising at first that acne can have that same quality of life impact as these major diseases, but when you think about it, it's on our face, it's on our chest, it's on the parts of our body that we present to the outside world, and it's a very important part of who we are.
As a result, depression, social phobia, and certain anxiety disorders have been associated with adult acne.
Oftentimes I see a lot of bumps there.
As an esthetician and counselor, Allison O'Neill treats both the skin condition and the emotional impact of acne.
And it is difficult for other people to see it, so there's no redness, in other words, around any of this. It's just blocked pores.
She finds when patients are able to get their acne under control by understanding the course of the disorder, how to cleanse and protect their skin, and how to properly use medications prescribed by their dermatologists, they do better emotionally.
It's really just about our lives and understanding our bodies. And this is the largest organ of the body, and so it's our responsibility to understand it and live with it.
You just want to put your best self forward. It really can be devastating. It kind of makes me emotional thinking about it. It is under control now at this moment, and looking at me, you think that it's fine, but it is upsetting.
For WebMD, I'm Rhonda Rowland.